That's a good question. I think vascular surgery nowadays is an endovascular era, and it's good for a young vascular surgeon to actually opt and have this technique as an arsenal to be ready to set up for any patient, especially in emergency settings, to set up for that and treat them actually. Open repair is less frequent and very rare in the nowadays practice. So we don't really receive training in that sense. So training in the endovascular era in these new expanding techniques should be promoted, I think, by all the organisms, as for workshops and simulators, to actually get trained and opt for it and be able to perform it in any setting, in any emergent cases or life-threatening pathologies nowadays.